And I was glad to hear something at least about doctors, because I was absolutely struck last evening and this morning hearing all kinds of projects, but very little mention of the involvement of physician staff in the projects, even though I know that they're there. And I think that's something you've obviously addressed in your 2 centers. I don't know whether we've also, I think, heard that there may be some tipping points, but for the University of Montreal, I heard more gradual progression over time. And perhaps for you, it was more a question of using data and involving people. Does anybody have any questions for the 2 speakers? I don't know how long you want to keep the question period, because we're still running a little bit late, but just a few minutes anyway.
We can take a couple questions.
Yes.
Thank you. That's a wonderful presentation. And I'm very interested in the HEART program that you've described, because I think that's taking hold in Canada in a different way. And can you just describe a little bit about how physicians go through that education, and whether it's customized to them or whether they're part of an interprofessional team as they gain that education?
It's interprofessional. It's not customized. Everybody goes through the same program. And we talked about, mentioned using data. We were very transparent with physician data around how they communicate, which generally was pretty bad. And that became the burning platform to really get the physicians more engaged. You have to use data to engage physicians, because ultimately they'll see it. If you tell them they're not doing well, they won't believe you. But if you show them with data, they have no choice but to believe you. And then after they get over their initial anger, they're going to look to you for solutions. So the HEART program, as well as everything we've done to develop the physician culture, is the same for the things we use for everybody else.
Other questions? Comments?
Yeah.
J'avais une question pour M. Dumez. C'est très intéressant ce que vous présentez, mais vous savez sûrement que c'est difficile d'obtenir la participation des usagers, parce que ça demande beaucoup de temps et les usagers sont souvent malades, et c'est une chose de les impliquer au niveau de leur traitement personnel, qui deviennent vraiment partie prenante d'une équipe soignante, mais ça devient difficile lorsque on parle d'une participation institutionnelle. Et moi, quand je regarde la réforme proposée par le Dr Barrett, j'ai encore plus peur, parce que moi, là, je suis un patient ici au CUSUM, et je dis souvent, nous sommes 14, vous êtes 14 000. Alors là, on est en train de créer aussi d'immenses structures, et comment les usagers, comment on va arriver à vraiment ce niveau de participation-là.
Vincent, could you stand up too, please, when you answer? Thank you.
So, I'm not going to comment on the Barrett reform, if you may. Not now. Recruiting patients is not, we didn't have so much difficulty to do it inside the Faculty of Medicine. I know it's more difficult in hospitals, because, you know, it's easier for patients to say, yeah, we want to teach to our students, to our professionals, so it's not so difficult to do inside a Faculty of Medicine or Health Sciences department. So, yes, we can be a little bit afraid of how we're gonna manage patient involvement in the future regarding what's happening now. We are a little bit disappointed, because we thought that we were on a trend of public engagement and patient engagement, and it doesn't look like this. And here in Quebec, we're going to have mega centers, so I don't think we're going to get closer to the patient. Maybe, but I don't figure out how at that moment. Maybe in 2 or 3 months, maybe. So we'll see what's going to happen. But for sure, for patient recruitment and training, there is a methodology, there is an approach, there is a way to do it. And usually what we do it informally. And it has to be it has to be taken seriously in how we do that. We don't choose patient like you look good, or you look intelligent, and so come on in, or you have time, so okay, you can get involved. So it's a strategy, a very complex strategy, but when you mobilize this strategy, it's working out, I think.
Hi, I'm Lena Cuthbertson from British Columbia. Dr. Merlino, I have a question. Your presentation was fantastic. I heard you yesterday as well, so it was great to build on that. You talked about managing expectations, and then you shared with us some of the analysis that you've done with your HCAP survey results and actually building of modules related to how to educate your patients and I guess providers. I don't know all the details. I guess my question is, there's a lot of sense that sometimes, and I'm in the business of measurement and using survey results, but there's a sense that sometimes we game the results, so that when we, try to help patients better understand our processes and our systems and how we work together and what we're trying to accomplish, we're really trying to game the fact that when they get their survey, they will give us a higher score. So I'm curious as to whether you've had some of that same feedback or criticism and how you address it.
So I think first of all, you have to apply that against your organization strategy. So our strategic goal is to improve the patient experience. And we collect a variety of, as I said yesterday, pieces of voice of the patient to make sure that we get a holistic view. Now, when we first did our expectation study specifically, somebody said to me, well, we're gaming the system. But I don't, and does it drive higher scores for those questions? In some cases it does. But I don't think educating patients about what they're going to experience in the hospital is gaming. I think it's the right thing to do. Because if you look at the focus group data on what drives high anxiety, it's the uncertainty of not knowing. I'll give you another example. So we had a physician, an orthopedic surgeon, who had very low pain scores. And in the same practice, we had another physician who was really high. And so we observed them. And the guy who had the really low scores had been in practice for 30 years, and the conversations he would have with his patients were something like this. I've been doing this for a long time. You're in good hands. Don't worry, you're not going to have any pain. I'll take care of you. Now, the guy who had good pain scores had a very much more realistic expectation and said, look, you're going to have a lot of pain. We will do everything we can to manage it. We can never take it completely away, but we have a lot of tools available. So if you're a patient, what do you want to hear? The truth? Or this guy who's bragging about the fact that he doesn't know how to have a conversation with a patient? So that's about, it's about communication, and I think it's about level setting so that patients know exactly what they're getting into. Because I think it's only fair. I mean, we don't communicate well with patients. We've looked at a variety of different studies, and physicians are the absolute worst. We think we're great, but we're terrible. And so we need to drive those expectations because I think it's right for patients. I hope my presentations were consistent.
Thank you very much. Thank you, both of you.